Hi there, my name is Katelyn Smalley. I'm a doctoral researcher at Imperial College London, and I want to thank you for joining me here today for this talk. I also want to say a big thank you to the organizers of this year's Health, Wellness, and Society conference. It's unfortunate that I'm not able to be there and meet all of you in person in Paris this year, but I'm looking forward to meeting you in the future. I'd also like to say a thank you to my supervisory team, Mr. Eric Mayer, Dr. Lisa Ofeger, Dr. Kelsey Flatt, and Professor Ara Darzi. I'd also like to say thank you to the NIHR Imperial Patient Safety Translational Research Center, which funds my research. My presentation today is called Improving Self-Management by Assessing Patient Expertise, and this is a mixed methods study that is part of my PhD. So just to start out with a bit of context about self-management, chronic diseases are becoming more common across the globe, which also means that self-management programs are becoming more important as people need to learn how to manage them. And despite an overwhelming number of studies, at last count, there are about 12,000 studies that mention self-management programs. The effect of these interventions are kind of unclear at best. And this is really because self-management programs are complex interventions. So trying to trace the intervention all the way to the impacts that we care about is a bit of a challenge, and there's a bit of a winding road to get there. So in theory, what happens is that a self-management program provides education or training, which increases people's knowledge and skills. These new knowledge and skills encourage people to change their behavior, which in turn lead to health impacts, so better health outcomes, and also changes in the way people use services, so there are resource use impacts as well. This kind of chain of events is mediated by a person's self-efficacy, so their confidence in their ability to engage in a behavior. And we can see that self-efficacy kind of operates in a feedback loop, because when people are kind of inherently more confident, it's easier for them to pick up new knowledge and skills. But then on the other hand, having new knowledge and skills in turn makes people feel more confident in their ability to put them into practice. Now, one of the challenges with this when we're looking at self-management programs and evaluating these interventions is that most of the focus is on these kind of downstream effects. So looking for evidence in changes in people's health status or in the way that they're utilizing healthcare services. And this makes sense because this is ultimately what we care about from these programs. But the challenge is that they're a bit far removed from the education and training. So we don't routinely measure people's knowledge or skills. And in that way, it's difficult to, it's difficult to ascertain that an effect that we see on health outcomes or on resource use is really attributable to the self-management program or not. So before I move on from here, I just wanted to lay out a few key concepts that I'll be working with for the rest of the presentation. The first is self-management, which I define as a set of actions and behaviors that allow patients to do three kind of major buckets of things. Number one is to manage their own health outside of a healthcare setting, to know when and where to seek help when they do need to seek healthcare, and then once they are in a healthcare setting, to be able to interact effectively with those healthcare providers and make sure that they get what they need. Self-management programs are essentially interventions that provide education and training to enable people to engage in these self-management behaviors. And then finally, self-management expertise is a set of attributes that enable patients to engage in self-management and make sense of their illness as part of their identity and daily life. So if we think about the previous diagram, the self-management expertise is kind of the totality of the knowledge and skills that are required to engage in self-management behaviors. So this project, the aim really is to improve self-management support for chronic respiratory illnesses. And the specific objective that we're going to talk about today is to objectively and reliably measure self-management expertise for people with chronic respiratory illnesses. Just as a brief summary of the methods that I used for this project, I did try and triangulate data from a lot of sources. I did 2 systematic literature reviews, one on patient expertise kind of writ large. The second one was looking specifically at self-management interventions for chronic obstructive pulmonary disease, so for a particular chronic respiratory disease. I then went deeper into understanding what self-management looks like in practice by interviewing patients, clinicians, and policymakers who have experience of chronic respiratory diseases. And then I used all of the kind of totality of that information to develop an assessment tool of self-management expertise with the help of an expert panel in a 3-round Delphi exercise. So to move from understanding what the domains of critical self-management knowledge and skills are to figuring out ways that we can ask patients and assess whether they possess those characteristics. The final piece of this puzzle is to do a quantitative factor analysis and some correlations and regressions to validate the assessment tool and see how well it performs compared to other patient-reported outcome measures. So why focus on chronic respiratory? There are really 2 main reasons for this. The first is that they're very prevalent, particularly in the UK where I'm based. The British Lung Foundation estimates that about 1 in 5 people have a long-term respiratory illness. And these diseases are also have a high disease burden in terms of mortality as well. So again, about 1 in 5 deaths in 2012, second only to cardiovascular diseases. On the other hand, chronic respiratory diseases are also what I would call amenable to self-management, which means that they are diseases that kind of require a lot of activity on the part of the patient, which means that there is actually a need for training and a need for knowledge gains in order to be able to successfully manage the kind of lifestyle environmental changes that someone needs to take into account when they have a long-term illness like this. There's a lot of, it's quite a high touch disease in terms of the self-management requirement, or set of diseases rather, in terms of self-management requirements. So the next set of questions really is, what do people need to know and what should they be able to do in order to self-manage safely and effectively? And that was what I set out to understand when I interviewed patients and clinicians and policymakers. And actually I found that what people were telling me actually fits quite well with the COM-B model of behavior change that was developed by Susan Michie and colleagues at University College London. Essentially, this model posits that people's behavior is a product of their capabilities or their ability to engage in the desired behavior, their opportunities and their supports to do so, and then also kind of their psychological motivation to make a behavior change. And in terms of self-management, what we see is that the capabilities that are required do come back down to knowledge and skills. So what kinds of knowledge? People need to know what the problem with their lungs are. They need to understand what their baseline symptoms look like. They need to know what to do for an exacerbation. They need to know how to seek out reputable information. And again, when to seek professional help and where to go to do that. Similarly, in terms of skills, this is less what to do and more how to do. So how to use airway clearance techniques and drugs and devices properly, how to engage in shared decision-making and other communication skills with their healthcare providers, and then how to manage their condition on a daily basis. So making healthy lifestyle choices and monitoring triggers such as air pollution or other environmental factors. In terms of opportunities, this is something that we can think about institutional supports. So pulmonary rehabilitation, having accessible respiratory nurse or physiotherapist that they can contact, having wraparound mental health support is really critical, especially in chronic respiratory diseases. There is a tendency for those to be comorbid with mental health problems like depression and anxiety. And then also kind of the broader social supports are really important. So in terms of friends or family that can be relied upon to fetch groceries or medicines, or to be there as an emotional support. And then also having that trust and respect from the care team, that patients feel like they are kind of part of the team from their own care, and that when they voice a concern, that it'll be respected. Um, in terms of motivators, this kind of ran the gamut from coping expertise and resilience, to, again, going back to having confidence in the ability to manage a disease. So that actually is something that motivates people to want to engage in self-management behaviors when they feel like they can do it. Again, feeling like you're in control of your own life is something that furthers the motivation to participate in self-management behaviors. And then for a lot of people, it is just as simple as wanting to avoid hospitalization or preventing deterioration of their condition. So one of the things that we see is that for a lot of people it's when they get quite ill or when they're at the risk of becoming hospitalized that they start to take self-management seriously. And so that's something that we need to keep in mind when we're thinking about what motivates people to engage in self-management behaviors or not. In terms of behaviors, you'll notice that these are they go quite hand in hand with the knowledge and skills. This is really just kind of putting those things into practice. So one thing that's really critical in chronic respiratory disease is smoking cessation, doing some form of mild or moderate exercise regularly, keeping an eye on the environment and triggers. Again, not just knowing how to do airway clearance or proper inhaler technique, but actually utilizing that. And then again, not just recognizing when an exacerbation is happening, but to go get the help that is needed and deal with it as quickly as possible. So the set of questions that follows on from this is, how can we measure whether someone has this expertise or not? And to do this, I looked specifically at one chronic respiratory disease called bronchiectasis. And the reason that I focused here is because, on the one hand, the population of people who have bronchiectasis are a somewhat more homogeneous group than other diseases like COPD or asthma, conditions that are a bit more widely known. But the other thing is that it's a vicious circle of infection and inflammation. And the cyclical nature of this disease, such that an infection leads to inflammation and tissue damage, which impairs lung function and then increases the proneness to infection, means that patients they learn over time about how their disease works. So they get a very sophisticated and nuanced understanding of their own symptoms, and when there's a change from baseline, that means that there's something that they need to pay attention to. They understand which antibiotics and other medications work well from them and which ones don't tend to work well. And then they end up figuring out how to manage their symptoms on a daily basis, manage their exacerbations, and then also start sharing more in the decision making around how to treat and avoid exacerbations in the future. So it's a disease that is actually quite, as I mentioned before, quite amenable to self-management. So to develop this assessment, I convened a group of 30 people, 10 patients, 10 clinicians, and 10 policymakers. And we discussed over the course of a 3-round online Delphi, both the content domains that were required knowledge in order to self-manage bronchiectasis effectively, and then we moved from content knowledge to actual questions that we can ask patients, questions and answer choices that would produce an assessment of a person's level of self-management expertise. So the final assessment consists of 20 items that are testing essential knowledge and skills. They range from simple multiple choice, like question number 3 on your screen, to true-false questions, like question number 7, and then vignettes, like question number 15, that are really getting at kind of more challenging behaviors and processes around recognizing which kinds of deterioration require seeing a healthcare professional, or how someone would approach a shared decision-making scenario, things like that. Kind of the range of domains of knowledge, again, track fairly closely with what we had learned from the interview study. So things that were critical were sources of reliable health information, having at least a tacit understanding of the specific lung problem that is bronchiectasis and how it's different from other diseases, the importance of healthy lifestyle, kind of the reasons that those are so critical for someone with a lung disease, and then kind of more healthcare setting related, knowing when to go and seek help from a professional, understanding, this is really critical for bronchiectasis in particular, is understanding certain specific aspects of antibiotic courses and the risks of antibiotic resistance for them, and being able to balance those two. Skills, again, track pretty closely from the interviews, but we asked questions around maintaining healthy habits, what those look like, what effective communication with a healthcare provider might look like, how often to use airway clearance techniques and what types of techniques those are, recognizing deterioration, and then also really critically, this kind of ties back in to shared decision-making and the issues around antibiotics, is that it's really important for patients with bronchiectasis in particular to feel comfortable challenging clinicians when they believe that they've made an error or they have a disagreement. Patients with bronchiectasis need to have a longer course of antibiotics than other people do when they have a respiratory infection, but not all GPs or emergency physicians are necessarily familiar with that or have that top of mind. And so they need to be prepared to push back and to say, no, this is actually something that I need and it's different than general practice guidelines. So that's something that's kind of an interesting self-management skill that is particular to this condition. Also, over the course of the Delphi, we did discard some items. These fell into two general buckets. One of them was that the consensus was really just that they were not relevant for this particular population. One that surprised me a bit is that numeracy was kind of across the board. People said that's not hugely relevant for this group of people. It's not really going to matter much one way or the other whether someone's fluency with fractions or probability or things like that is not really going to affect their self-management capabilities. Another thing, peak flow monitoring is another example of something that might be really important for someone with asthma or maybe COPD, but regularly monitoring and taking those measures is not going to be helpful for someone with bronchiectasis, so they're kind of things that we set aside. There was another set of questions that everyone agreed were actually relevant and important for people with bronchiectasis, but the challenge was just that they're highly individualized, and so in the context of an assessment tool that we'd want to be able to disseminate widely, it just wasn't practical to include them. And some of the really important ones are understanding your baseline symptoms, which is just a very personal set of baseline symptoms. So this is something that is never going to be the same for two people. Also knowing whether you're colonized by any microorganisms, and if so, which ones. That's something that is not the information is not going to be the same for everyone. And similarly, for patients with multimorbidity, we're recognizing that that's hugely important in the way that people think about managing their conditions. But the kinds of different implications of different combinations of diseases, multimorbidity is something that the implications of that are not quite clear. It's difficult to say in a general way, to test in a general way someone's understanding of how one disease might interact with others in this context. So we decided to leave those out. Finally, in terms of future work, this is the last piece of this project, and unfortunately this was planned to be done over the course of the spring and summer 2020, and obviously because of COVID-19, we had some challenges here in terms of data collection. The purpose of this final bit of the project is to validate the assessment, so test its validity and reliability, and also its performance compared to other metrics that try to measure similar things in the self-management and patient engagement space. The idea here is to send out the assessment to roughly 200 patients and then link their scores to some clinical and demographic data and explore the properties of the assessment tool, and then also the way, how well the assessment tool correlates to some clinical outcome measures, so hospitalizations, A&E visits, courses of antibiotics over a course of the year, things like that. And then also we wanted to compare, I wanted to compare this performance of this measure, how well this measure predicts those clinical outcomes compared to, for instance, the patient activation measure and the chronic disease self-efficacy scale, to see whether this does really isolate those causal mechanisms in the self-management program pathway. And then in terms of outputs, what we're really hoping from here is that on the clinical side, the assessment tool will be able to identify patient education needs as a way to fill those needs. And then from a research perspective, that this tool will be useful in terms of evaluating self-management programs by using it as a pre-post test of knowledge and skills to see how good the intervention is actually at transmitting self-management knowledge and skills to patients. So just wanted to leave you with a couple final thoughts. Patients' ability to self-manage chronic diseases really comes down to their capabilities, opportunities, and motivation to engage in self-management behaviors. And while self-management plans aim to improve their capabilities, we can't improve what we don't measure, and we currently don't do a great job of measuring those capabilities in terms of people's self-management knowledge or skills. And then finally, it's really important that we do this because identifying people's strengths and needs in terms of self-management will allow us to more appropriately target services and support to people who need them and tailor these opportunities to specific individuals and their needs. It'll also help us to provide more opportunities for patient engagement and more appropriate opportunities for patient engagement based on people's interests and their strengths. And then just finally to have a more equitable and efficient use of resources, broadly speaking. So making sure that people get what they need when they need it, and that patients can really be as involved as they'd like to be, while also having a high quality of care and safe care. So with that, I'm going to leave it there and say thank you very much for listening to this presentation. Please feel free to reach out to me via email or Twitter. I'm really looking forward to discussing this and other things with you, and I'm looking forward to the rest of the conference. Thanks very much.